Ethical consideration. Introduction to ethics. Ethics is defined as to what we consider to be right and wrong, a moral code or a set of values. Values are challenged and examined daily. Code of ethics. Their professional organizations often identify their code of ethics as codes. Codes of ethics from the American Association of Medical Assistants. There are principles of medical ethics from the American Medical Association. Code of ethics are constantly changing and evolving. Are you continually learning? Are you service-oriented? Do you radiate positive energy? Do you believe in other people? Covey's 7 Habits of Highly Effective People help people to take a more personal look at themselves by asking, do you lead a balanced life? Do you see life as an adventure? Are you synergistic? Do you exercise for self-renewal? The 5 P's of ethical power. Purpose. Understand your objective or your purpose. Pride. Have pride in what you do. Patience. It takes time to create an atmosphere where your objective can be obtained. Persistence. To act in an ethical manner means to strive to act in a manner at all times. Perspective. Keep your life and your purpose in perspective. Ethics check questions. Is it legal? Is it balanced? Is it the best approach for all concerned? How will it make me feel about myself? Bioethics focuses on ethics in the healthcare field and those in our everyday life. Pertinent because of today's advancing medical technology. Ethics will be challenged in today's society. In the past, bioethics decisions were made mostly by physicians and esteemed members of the legal profession. However, advancing medical technology is giving the patients and the consumers a number of choices regarding their own health. Keys to the AAMA Code of Ethics. Render service with full respect of dignity and humanity. Respect confidentiality information. Respect confidential information. Uphold honor and high principles of the profession. Seek to improve knowledge and skills of the medical assistant. Participate in additional services and activities to improve health in the community. The AAMA Code of Ethics and the Medical Assistant Creed is found on page 125 in your book. Ethical guidelines for doctors. Advertising. Legal and ethical for a physician to advertise. They may include their physician's credentials, the type of practice, their services, and how fees are serviced. Managed care agencies advertise services and participating providers all the time. Confidentiality. We must not reveal information without consent unless required by law. Patients must feel comfortable revealing information. Some incidences that must be reported. When a patient threatens another person and there is reason to believe that they will carry out that threat. Certain injuries and illnesses also must be reported. These include knife and gunshot wounds, wounds that may be from suspected child abuse, communicable diseases, sexually transmitted diseases. Also information that has been subpoenaed. Confidentiality. When in doubt, get consent. Make sure you restrict access to computer data. Make sure you follow HIPAA guidelines. Medical records. Do not reveal information without the patient's consent. Records are the property of the provider and the patient. Physicians should provide a copy if the patient requests them. They cannot be withheld because of an unpaid bill, and you must transfer the records if they are requested. Professional fees and charges. The doctor should not charge excessive fees. Fees are usually based on customary to the location. They reflect the difficulty of the service and the quality of the performance. Fee splitting is unethical. The providers may charge for missed appointments if the office policy was known by the patient. Bill only treatments documented in the patient's chart. Professional rights and responsibilities of the physician. They may choose whom to serve, where they may not refuse patients on the basis of race, color, religion, national origin, or any other illegal discrimination. They cannot deny treatment of HIV patients. They cannot neglect or refuse patient treatment unless they withdraw the case. Some other rights and responsibilities of the physician. Only the provider should inform a family when a patient dies. They should expose incompetent, corrupt, dishonest, and unethical conduct by other providers. They may not treat patients if under influence of controlled substances or alcohol. They must take precautions if they have HIV. They must avoid conflicts of interest. They must eliminate the biased behavior towards an individual that is different from themselves. And they must encourage diversity when hiring. Care of the poor. The number of individuals with no health care is increasing. Care of the poor should be a regular part of everyday practice for the provider. Some services can be provider-free, or the providers can volunteer at a freestanding clinic that treats the poor.